Good evening, everyone. I'm Dr. Bonday. Given the plethora of data coming out regarding global and national COVID-19 cases, I wanted you all to get a local perspective, my firsthand narrative regarding COVID-19 here in Kansas City. So let's jump right into it. I'm a hospitalist that works in a number of different hospitals. Before we proceed, I do want to talk about my limitations. Uh, I only take care of patients with COVID-19 in the hospital. They're the mild cases that are being treated as an outpatient, I have little knowledge about, although I do take care of patients that have COVID-19 as an outpatient, but they're not really mild or asymptomatic. They are mostly patients that we have discharged from the hospital that I follow up on. So let's start with data from the Kansas Department of Health and Human Services website, and it shows this is 2 days old, unfortunately, and nevertheless, it shows us that there's been a total of 900 cases, 223 hospitalizations, and 27 deaths. Most of them are going to be Providence Medical Center, Olathe Medical Center, KU Medical Center being the forefront of those hospitals. And thankfully, it's only 27 deaths. So that means the ICUs, even because we're looking at a mortality around 40 or so percent in ICU patients that get intubated. Now, if you're an ICU patient that doesn't get intubated, it's much better. And of course, I'm just making a generalization here to make it easy for you to get an idea. This, on the Kansas side, Johnson County, Wyandotte County, is really good data that should reassure us. Me working in the hospital every single day, I am seeing, let's move to this next slide, I am seeing this graph in action. As you can tell, this is a graph that unfortunately I could not get from the Department of Human Health Services on the Missouri side, but it is shown here on the Kansas side, and if anybody can link to the Missouri side, that would be great. But this is what I'm seeing. This is what I'm observing in the hospital. There is a constant influx of the same number of cases. The rate of growth is not increasing. Matter of fact, one could say it's decreasing, even though we're seeing an increased number of deaths. Now, the increased number of deaths that we're seeing is reflective of what happened 3 weeks ago. So let me take you now to this other slide, which talks about the symptomatology, because this is crucial in understanding rate of growth and the constant increase in cases. The rate of growth has slowed, and actually it has slowed down on a national level. And this, of course, does not mean that there will not be increased number of deaths and increased number of cases. This means that we're going to see a decreased number of deaths and cases in the next 2 to 3 weeks. Because as you can see from this slide, that people are contagious around 1 to 14 days, day 1 to day 14 essentially, which is day 1 is when you get exposed. So we're talking about the actual way that you're infected or we're infected by this novel coronavirus is essentially a droplet. It is not airborne, it is a droplet. So it has to come out of the mucous membranes or wherever it's concentrated, diarrhea, droplets of diarrhea, vomiting, or the vomitus can then aerosolize and then enter our body to happen. Nevertheless, so you have day 1 to day 14 in most people is when they are contagious, because most people are going to have either no symptoms to mild to moderate symptoms. Now, those with mild to moderate symptoms, as you can see on this slide, they might be contagious up to day 20, even though we will generalize it to the first 2 weeks. So the patients who are actually presenting with critical symptoms, which are only about 5% or so, and 15% if we take severe and critical symptoms, they will continue to be infectious up to a month, if not more. And we have had patients in the ICU that keep coming back positive even after the 3rd week. So that's why this graph really depicts what's actually being seen in the hospitals. Let's take you to another graph to better understand the symptomatology. All right, so this particular slide is discussing the onset of critical and severe symptoms, especially in those that survive and that do not survive. And this is what I've seen in the hospital as well. Patients who report symptoms that happened about 2 weeks ago, and they think that they're getting better, clearly 2 weeks of suffering, of fever, cough, muscle aches, fatigue, all of those symptoms. And then around around day 14 or so, give or take, plus or minus 2-3 days, they start having even more severe symptoms, or they notice a rapid onset of disease. So why am I showing you this? I'm showing you this because when you look at deaths in particular, you're really getting a picture of what happened, or the infectious process that happened or that started 3 weeks ago. And so if I'm seeing a drop in new cases right now, then that means 3 weeks from now, at least in this area, I can venture an educated guess that I'm going to see a significant drop in deaths. Now, inner city is different. Unfortunately, for some reason, this has really affected our inner city population. Let me take you to another graph. So in this slide, we can see that basically starting from 40 years on, the yellow part representing what that's being hospitalized, that's what makes the majority of the vast majority of the hospitalizations, especially 70 and above. There's more than 50% of people in their 70s apparently are being hospitalized if they get infected. So let's go back and talk about cases in Kansas City, Missouri. Again, this follows along what we're seeing on a national scale, that inner city areas, high dense population where there's high comorbid conditions, that's where we're seeing the highest number of cases. So in conclusion, I just wanted to give you guys an idea about what we're seeing in the hospital.